Hello, my name is Stephanie Huynh-nhan, and my student identification is 22036673. Today I will be giving an oral presentation on the case of Teresa Manalo. I will first address the ATE assessment of Mrs. Manolo along with discussing the most suitable intervention. Lastly, I will outline the effective management, including medication that is prescribed to Mrs. Manolo. Mrs. Manolo has presented to the hospital experiencing an embolic stroke with a reduced level of consciousness, along with slurred speech and weakness on the left side. Our discussion begins with question 1, where I will be analyzing the ATE framework in order to identify any threats within the body of our patient. The airway of Mrs. Manolo shows that she is patent and open, where there are no signs of obstruction via a Hudson mask with 6 liters of oxygen. Following with breathing, respiratory rate is 26 breaths per minute, along with shallow breathing, which indicates that Mrs. Manolo is in respiratory distress, as her respiratory rate is faster than usual for an adult. Moving on to circulation, with 132 beats per minute, as her heart rate is considered tachycardic. However, her blood pressure indicates that Mrs. Manolo is hypertensive, as it is 170 systolic, systolic over 95 diastolic. Mrs. Manolo is cool to touch with less than 3 seconds of capillary refill. However, there is an indent fluid retention in her feet. Onto disability with a Glasgow Coma scale of 12 out of 15, which shows a sign of mild traumatic brain injury. Mrs. Manolo has slurred speech and is showing indications of weakness on the left side of her body, as well as droopiness on her face. However, her right side of the body shows normal responsiveness by squeezing her hand and leg. Her pupils are equal, reacting to light rapidly, and shape is round. Lastly, for exposure, there was no bleeding anywhere on her body, as well as wounds or redness. Mrs. Manolo is afebrile, meaning that she does not have any symptoms of having a fever. There is an intravenous cannula located on the cubital fossa on the left arm of Mrs. Manolo. Proceeding with question 2, where I will be addressing the 4 most suitable nursing interventions for Mrs. Manolo. Madhu and Ajibe 2025 has shown that physical therapy will aid stroke patients for both short and long-term results, as consistent involvement focuses on the process for recovery and reduces the risk of future stroke events. Therefore, physical therapy will aid Mrs. Manolo due to her left-sided weakness. It will strengthen and regain her ability to mobilize independently. As nursing interventions require physical therapy, it also requires clear communication, as nurses will implement this plan in order to connect with the patient along with encouragement. Um, that has been shown by Madhu and Ajibe 2025. With the case of Mrs. Manolo, communication will build trust between nurses along with encouragement that will help improve the ability to speak again, as her speech is affected due to the episode. With clear communication, confidence will further improve self support as it will aid her emotions and mental health. According to Batzak 2024, nurses must implement an intervention plan that has a specific care for stroke patients, such as monitoring the signs and symptoms of another episode with a better understanding of the procedure, especially in embolic stroke patients. Hence, nurses must monitor Mrs. Manolo in order to detect early deterioration, vital signs, and a potential chance of having another episode. Turning to question 3, where I will be discussing the three medication which are heparin sodium, metoprolol, and pantoprazole, along with the reason why these medications are prescribed to Mrs. Manolo. Heparin sodium is mainly used to eliminate as many clots as it is an anticoagulant, meaning that it is a blood thinning drug. This medication has been prescribed to Mrs. Manalo to treat blood clots due to the embolic events. Therefore, it will reduce the number of future embolic events as well as prevent blood clots from forming in order to get the brain to function. Higgins, Casola, Luong, and De Liao have mentioned that strokes occur due to an unexpected event of brain dysfunction, especially within the blood vessels, which is known as ischemic stroke, that is common. It has been shown within 2024. In the case of Mrs. Manolo, the blood clots can become dangerous as it can block arteries inside the brain, leading to a stroke event. The administration of this medication must not be given orally, but is given intravenously. The dosage, rate, and time are to be calculated to be given to the individual along with side effects such as hemorrhage. This has been shown through MIMS 2025. Nursing considerations for heparin sodium include flushing in a push-pause motion, known as pulsatil flushing, which will in order to maintain port patency as well as educating the patient about the drug. Law and Martin 2020 has shown that metoprolol is a medication that is mainly used to treat irregular heart rhythms, hypertension, and agnia in order to monitor the heart. Thus, Mrs. Manolo has been prescribed with this medication as she has high blood pressure. MIMS demonstrated that the undesirable effects are upset in the gastrointestinal, sleep disruption, fatigue that is activity related. This drug is given at the maximum prescribed dosage, and the tablet that is coated with film must be swallowed as a whole. According to Morris, Aswikar, and Dunham 2024, nursing considerations include indications control of the heart rate and blood. Therefore, frequent vital monitoring is crucial as the medication can reduce the heart rate significantly, making it dangerous for Mrs. Manolo. As Mrs. Manolo is already on heparin, which is an anticoagulant, the adverse effects are hemorrhage in areas such as ovarian, gastrointestinal, and urinary tract. MIMS 2024. Therefore, the doctors have recommended pantoprazole as it reduces the risk of contracting bleeding and prevent ulcers. As this drug improves the process of restoring the site that is prone to contracting hemorrhage, MIMS 2024 has shown that pantoprazole is administered as a tablet by swallowing the whole pill with water. The adverse effects of this drug can cause a person to have skin reactions such as erythema multiforme and Stevens-Johnson syndrome. Nursing considerations for pantoprazole include nurses often monitoring the vital signs and educate the risks and benefits of the drug, especially when combining herbal medicine, as it can reduce effectiveness of the drug. Nursing considerations with the prescribed medication are essential in order to administer the drug to Mrs. Manolo safely. With the three drugs, nurses must monitor any adverse effects and detect early duration, especially after experiencing a stroke episode, as it will prevent further complexity. Thank you for listening.